All right, thanks, Mike. Good dental hygiene practices start in early childhood. Dr. Neil Peterson is a pediatric dentist. He's here this morning showing us the right way to brush and floss. Thanks for joining us.
Thank you, Kim.
How soon should parents start with the brushing and the flossing?
Well, when it comes to dental checkups, Kim, it's always a good idea to begin sooner rather than later.
So we're talking as early as 2 years old.
Oh, sooner than that, age 1. The American Academy of Pediatric Dentistry and the Wisconsin Dental Association recommend that children be seen at age 1. And you might wonder, what could the dentist possibly do for a 1-year-old?
Yeah.
Mostly what we do is for the parents and for the family and for habits.
To get those started, and you've got some pictures up, which I was kind of amazed, of some of the dental problems that kids as young as 2 already start to experience cavities. And you're saying there's a reason that you're seeing this kind of damage so early.
Well, one of the big reasons is that there is a prolonged or extensive nursing or baby bottle feeding. A child shouldn't be allowed to fall asleep when they have teeth in the crib, drinking from a bottle, or even nursing mother's breast milk.
Because that can...
That's right. The child falls asleep, but that last swallow of milk doesn't go down, and the child ends up with a mouth that has milk still in it all night long.
And so the cavities...
First thing you know, they become cavities.
Another thing, you've got this frog, which is something that you use with your younger dental patients and their parents, the correct way to brush, because you said parents don't really get in there.
Well, I'm not so concerned about the technique that you use, but the important thing is that the parents brush the child's teeth at least once every day, so where the parent does it.
So the child gets used to, like, this is part of my routine.
That's right.
Yeah.
And the other thing is that in a perfect world, a child would have spaces in between their teeth, so the teeth stay self-cleansing. But if the teeth are close together, it's very important also to floss.
All right. What about fluoride? Because some parents are a little bit nervous, especially when you're talking about a 1-year-old child brushing with fluoride. Is that okay? Is that safe?
Usually around age 2, 2.5 is a good time to begin using fluoride toothpaste, but only use a tiny amount of it. And then if the child swallows a little fluoride, it's not harmful.
All right, and last question. If your child starts off with having cavities in their baby teeth, is this something that is, a precursor to what's going to happen with their adult teeth, or can you change habits that make your teeth stronger?
Well, a cavity won't jump from a primary tooth to a permanent tooth. But if you have a cavity next to a permanent tooth, a depression in the side of the tooth, if you didn't floss and food particles are trapped there, then the first thing you know, you'll have a cavity on the other side of the tooth.
All right, so brush and floss. It's the old advice, but it still really matters.
That's right.
All right.
Every day.
Dr. Peterson, thank you so much.